The following paid program does not necessarily reflect the views of this station, its staff, or Clear Channel Media and Entertainment.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and here we are again back live. It should be the 24th of May, 2014, and you got me for the next hour, and I can try to answer your questions regarding arm, leg, neck, or back pain. The lines are open, 521-8383. So call right now before things get backed up and you can't get through. Don't hesitate. If you're listening on a neighbor island, you can call toll-free at 1-888. That's toll-free, 1-888-565-8383. And we'll take your call. And I'll try at least to answer your questions. I am a MD. Started out as a general internal medicine doctor, practiced family practice for a while, went back to training as a physical medicine rehabilitation specialist. We're the guys that prescribe physical therapy for conditions that require treatment other than drugs and other than surgery. We use exercise and manipulation and spinal adjustments. Yes, we're MDs, but we do spinal adjustments. We use braces and all kinds of, we'll do whatever we have to do to maximize function. That's what a physiatrist is. That's what I am. And I have since then subspecialized even further into applying the approach of the physiatrist to physical medicine and rehabilitation, to orthopedic medicine, non-surgical orthopedics. So I've been practicing here. I'm just celebrating my 27th year, or is it 28? Yeah, I think it's 28th year at my clinic on Pi'ikoi Street, and we're about to move downtown after all these years. I'll tell you more about that. But let me take my first caller. Hello, you're on the air, and thanks for calling. Hello.
Hello.
Yeah.
Hello.
Yes.
This is Ivan O'Blanes. I'm trying to go to find out experience or go to, I go to Peripheral Medical Center, and I'm going to take care, trying. Now, they have referred me to a guy named Gerald Garcia over at Pahu. But because I live in Ilani, I found a guy named Acupuncture Del Coro.
You know, I can't quite hear you very well. Are you on a space phone or a cell phone? What's going on here?
I'm on a cell phone. Hold on.
If you can somehow get closer to your home phone, get closer to the base. You're too far from your base.
I'm too far from my base. No, I'm on a cell phone.
Okay. This is sounding better. Go ahead. Tell me first of all, what body part are you talking about? What's hurt?
Okay, I have after X-ray, the X-ray that told me I have a degenerative L4, L5, and
see.
L1.
And do you hurt to sit when you sit too long? Is that what hurt you? Or
yes, but this has been happening for a long time, but it didn't really bother me till about a couple of years ago.
Right, and sitting is the main problem if you try to sit through a long dinner or sit in traffic or sit through a movie. That's your main problem?
Right now, it's like because I'm ranting and I also taking Acupuncture 800. Maybe like about every 6 hours I get a pain on my leg, sciatic. They call it the sciatic nerve.
Okay,
like
but you have to try to listen to my question more carefully because I ask one question and you answer another. I understand that 6 hours after you take your pill, you get pain in your leg that you call sciatica.
Right.
But I'm asking not that. I'm asking this. If you sit too long, is that when you get sciatica?
No.
Is it standing too long?
I I think it's standing too long, yes.
Yeah. So if you weren't taking those pills, or if you stopped taking those pills and you stood up for too long a time, it would hurt. If you then sat down, would you get relief?
Yeah, because I kind of put it at rest.
Okay, but the answer is yes, no buts about it. You sit down, you get relief.
Yes.
And how old are you?
I'm 57.
And how long have you had this? A couple of years, I think you mentioned.
Yes, a couple of years ago, I used to be an avid runner, and
right.
Then they found out that my CK, carotene count or whatever, was high, and they told me to get off, but I was taking Stocor, and they found that was causing that. So
what?
It took me off, yeah.
What were you taking? Stocor?
Stocor. Stocor. The Stocor is that, it's for cholesterol, for high cholesterol.
I see. Anyway, over the phone it's quite difficult, and for some reason the connection's not great. But when a 50, 60-year-old man has pain with standing or walking, relieved with sitting, it's almost always a condition called spinal stenosis. Other possibilities include a hip joint problem or a SI joint. But the good news for you is, even though you've had it for 2 years, it's probably diagnosable. You know what I mean by that? It's probably able to be figured out. And once we figure it out, it's got a treatment that goes with it. Now, the treatment, depending on what this is, the treatment may not be curative, but it might be a treatment that'll help you manage it and control the symptoms and improve your ability to stand and walk.
Right.
So that's about the best I can do under the circumstances, is encourage you not to live with it, not to have any surgery yet, but to see a specialist that will look at you diagnostically very carefully, not just looking at the test, but actually examine you and talk to you. And then if it is spinal stenosis, or whatever it is actually, then the doctor, the specialist, will likely be able to give you your reasonable treatment options at that time and proceed from there. I just want to leave you with this. There is hope for you. You don't necessarily have a problem that can't be managed.
Okay, my main question was that if you knew about Dr. Gerald Garcia and Dr. Todd Cotto, see which one would be a better. The reason I picked up Todd Cotto is because I live in Mililani and he's over in the Mililani Town Center. And I just wanted you to know, if you knew them, tell me which would be a better doctor to go to.
What is Dr. Joe's first name?
It's Gerald Garcia. He's over in Waipahu.
Yeah, I don't know him personally. I think he's a pain specialist.
Right, so pain management.
Yeah, and who's the other guy?
Todd, K-O-T-O, Todd Cotto. He's over in
he's also a pain specialist.
Right. They both have the same, would they both do the same,
Yeah. So, well, as far as I know, they both practice pain medicine. They're not orthopedists. They're not going to make your diagnosis any more accurate. What they're going to do is try some shots, which is not a bad idea, but my first choice would be to first see a diagnostician, somebody who is going to try to better understand why you're having the pain, what structure, which disc, which bone, which ligament, what is causing it, and then try to treat it. And then, I sometimes send my patients to pain specialists, but it's usually after I'm done with my diagnosis and I've tried the various safe non-surgical treatments that I do, and if I still fail, then I send them to a pain specialist. They take care of people who aren't about to get cured. They just need a way to get pain relief, which is true. But you want if possible, you want to make the condition better.
Yeah, that's what Tripler referred me to.
Yeah. Well, that Tripler, yeah, they refer people to pain specialists, but I don't think it's a bad idea. I mean, they may have a shot for you that really helps. So I'm not telling you not to do that. It wouldn't be my first recommendation. I would rather you see a non-surgical orthopedist like myself or someone else in town to get to the bottom of this and at least try to fix it before we...
Okay, now, after an MRI, they found out that I have an L4 and L5 protruding, and also an S1, I think.
Yeah, well, disc protrusions can cause pain, but when they do, sitting is generally the worst, and standing gives relief. With you, it's the opposite.
Mm-hmm.
So sometimes we see things on MRIs that appear abnormal, like your bulging discs, but are not likely directly related to the problem at hand.
Okay.
You understand? Because if those bulging discs were giving you trouble, sitting would be killing you.
Right.
And standing would relieve it. You have the opposite.
Right.
That's how tricky this little game is played.
Mm-hmm.
All right? So best of luck to you. I didn't get your name because our equipment's off. What's your name?
Ivan or Ivan.
Ivan, best of luck to you, and give me a call next week if you don't get any satisfaction or get any headway. Or you could probably get referred to my office. I see a lot of people out of Tripler.
Okay, and you do accept trachea, yeah?
Yeah.
But where are you at?
We have two offices. One is downtown. One is in town on P.E. Koi and Kapiolani.
Okay.
And
605?
615, yeah.
615, yeah, okay.
Yeah, that's one, and that's probably closest. We also have one in Kaneohe if you like to take the H3.
No, I live in Mililani.
Yeah.
I was trying to pick somebody in Mililani.
Yeah. Okay. Best of luck to you, and thanks for calling.
Okay, thank you. Bye.
You bet. You're listening to Dr. Bernie Portner. We're just getting started. The number here, 521-8383. Hope you're enjoying the show even half as much as I am. We have plenty of time. It's only 7:17. We're going to go to 8. And if you call 521-8383, or if you're on an outer island, say Big Island, Maui, Kauai, Molokai, wherever you are, Maui, you can call toll-free 1-888-565-8383. That's toll-free also. I also understand, and this is the changing times, I also understand that there is building a larger and larger group of radio listeners for my show on the mainland. They go to iHeartRadio.com, and it's broadcast live, so if they're on the East Coast, and it's 7 o'clock now, it's 2 something there, because 6 hours. So it's 2 something there in the afternoon, the same Saturday. So that's kind of in the middle of the day. But in any case, I do have listeners that go out of their way, and when they can, and they listen to me on their computer, iHeartRadio, it streams live. So those guys, too, sometimes call in. I think you have to use the 808-521-8383 number. Quick announcement. I've been, last couple of weeks, I've been announcing a very important seminar that my buddy Dave Bernstein is putting on about estate planning, talking about wills and trusts. And the last week, it's happening this week. Today is sold out, I understand, at Kahala. I don't think you could get in, or standing room only if you want to stand through it. That's at the Waialae Country Club at noon. But tomorrow there are still seats available from 2 to 4 at the Ala Moana Hotel over there on Atkinson Street. You can call and make a reservation, 533-3243. That's 533-3243. And this is a way to learn how to protect your assets and help the people that you leave behind should you die or become incapacitated. doesn't matter if you already have a will or already have a trust or don't have either. You still have a lot to learn here. So I recommend it. The guy knows what he's talking about, Dave Bernstein, this Sunday at the Ala Moana Hotel, 2 o'clock, free and poo-poos. So how do you beat that? Let's see. I got my next caller, Carol. Carol, go ahead. You're on there, and thanks for calling.
Hello, doctor. I have edema of both legs and ankles.
Yes.
And I'm wondering what I should do about it.
So you should ask your doctor. What does he say? What does the doctor have to say about your edema?
Well, that I should use compression bandages. That's it.
I see. And does he explain to you why you have edema?
Well, the fact is that the blood is not going to my heart.
Yes, that's the general reason, isn't it? But when you push down on your shin where the edema is, and then you take your thumb away, does it leave an indentation?
Let me do that, please.
Go ahead. This is called pitting edema. When you push down on the edema and then take your thumb away, it leaves an imprint for a while.
Yes, it does.
So that's called pitting edema because you leave a pit. And the major serious causes of pitting edema is heart failure, kidney disease, or liver problems. And then there's less severe causes like vascular insufficiency. The veins in your legs don't have valves that work anymore, so the blood leaks out. Or the lymph nodes. You have a lymphatic system that people don't know about as much. It's a vessel system, but without blood. It just has what's called lymph fluid. And this can be blocked, so you might have a blockage of that. And if your doctor has already carefully tried to figure out why you have this and has ruled out heart, liver, or kidney disease, and they just think that it has to do with poor veins or poor lymph vessels, then I guess tight support hose is the way to go. Keep your legs up when you can. And, you want to probably avoid salty foods. You ask your doctor about that. That can increase the edema. But I don't otherwise have any major tricks for that. Sometimes they give you water pills to get rid of that. Have you been given any medications?
No, not yet. But we're going to have a test next week at Schwab.
Yeah. So while I can't answer your question, I can give you some questions to ask. Okay?
Okay.
When you see your doctor, you ask, why do I have this fluid in my legs? Is it something serious with an internal organ? Is my heart not working right? Is my liver not working right? Are my kidneys not doing their job? That's the three major things to really worry about. If he says, no, nothing wrong with your heart, nothing wrong with your liver, nothing wrong with your kidney, you're fine, this is just a circulation problem, you say, well, that's a relief, and then you go ahead and do what he says. Even if there's no cure for it, he'll help you manage it and keep it at bay.
Okay, thank you so much. Have a good weekend.
Okay, you too. Aloha, Carol. Thanks for calling. Bye-bye. So that's not exactly orthopedic medicine. That's internal medicine. But pitting edema can be an ominous sign. When your heart isn't pumping all the blood that's coming to it, it's too weak. The heart muscle just can't keep up with the blood return. It backs up in your venous system all the way down to your legs to the capillaries, and the water, the fluid, the serum that the blood vessels are containing leak out. The red cells don't leak out. The blood cells stay in the vessels, but the fluid leaks out. So you get this edema in between the cells, and that's not a good sign if you have heart failure. The same is true with kidneys and livers. That has more to do with the protein in your blood, and that starts to get complicated with osmosis and things. But edema is never something to be taken lightly. Now, it's true, like in this last caller, Carol, she had edema, but maybe nothing wrong with her major internal organs. It might have just been incompetent veins. Our veins have valves in them. And veins, as you all know, carry blood back from the body, from your fingers and toes and wrists and calves and forearms and thighs and arms and all your body, and all the blood comes back after giving oxygen and nutrition to your cells. The spent blood that now doesn't have any oxygen in it, that gets back to your heart. And if the heart's not pumping as much as the blood is coming back because it's failing, the heart is failing, then you have a big problem. You have edema, and you have to do something to make your heart stronger. You have to do something to get rid of the fluid. It's a big deal, and you got to see a cardiologist, not a simple country doctor like myself takes care of back pain. Let's see, the number here, 521-8383. The lines are open. If you have a question for me, give me a call, 521-8383. If you're on a neighbor island, 1-888 is a toll-free prefix, 1-888-565-8383. I'd like to take a quick minute to again announce the imminent arrival of Dr. Bro from Tennessee. He's coming with his lovely family. I think they're arriving later this coming week. And starting, if I'm not mistaken, starting in our office on Peekoy Street a week from Monday, if I'm not mistaken. And we're all very excited about that. And hope he has a good trip, and can't wait to get that started. Dr. David Bro coming out of Tennessee. He will be joining me as a fellow for a year to train under me, and then to stick around, and he's going to work in the new clinic downtown, which brings me to another quick announcement. If you don't already know this, I am moving my 28-year office from Peekoy Street over to Bishop Street downtown. Yes, we're moving downtown. And that's happening in August, and don't freak out. The traffic is easy. It's right off of Beretania, just Mackay of Beretania on Bishop Street, and there's tons of parking, and it's validated, and there's a parking attendant, and the stalls are big, and it's easy access. So we're going to have a great new clinic there, and I'm sure you guys will get excited as soon as you see it, the people that come to see me. Let's see. I have Con here, line 1. Go ahead. You're on the air, and thanks for calling.
Hello?
Yes, go ahead.
Yes, Doc. This is John.
Oh, John. Sorry, they misspelled it. What can I do for you, John?
Well, what I had was a couple of years ago, I was incapacitated with 24 lesions in my brain, and I was pretty much wiped out for about a month. They gave me steroids and got me to recover. But over the last couple of years, I haven't been able to get rid of this pain. It's in the lower of my buttock and runs down to the bottom of my feet, my foot, and my feet are always cold also. But this pain, if I sit, I can rest all night long, plenty sleep everything, but if I sit for a long, not even a long period, maybe an hour, then I just start to fall asleep.
Are you there?
Yes.
Uh-huh. And
I think it's sciatic. If I think that's what it is, but I'm not sure.
Okay.
My internal medicine guy, he don't know. My neurologist, he doesn't know.
Uh-oh. It looks like you need another guy. You need another opinion. Sciatica. Let's talk about sciatica. Are you new to this show? Have you heard my show before?
No, I have not.
Right. So, because if you had, you would have learned by now that sciatica is never your diagnosis. Your sciatica is not interesting information. The fact that you have sciatica only tells us what your complaint is. Sciatica is defined as pain down the back of the thigh, and some people include the buttock. And so if you tell your doctor, I got pain down the back of my thigh, and he pokes and prods and x-rays and tests and MRIs, and you see him the next week, and he says, all your tests come back, and you know what you have? You have sciatica. He's telling you what you told him. So sciatica is what's called a symptom. It's a description, a very specific description of your complaint. It in no way gives us any insight into what the heck is going on. So that's number one. Having sciatica is your symptom, but what is causing your sciatica? That's what you need to find out. Common causes of sciatica, for example, are a disc protrusion in the lower back, pushes on nerves, sends pain down the legs. If it's a disc, it usually hurts with sitting and not so bad with standing. Does that describe you?
If I start sitting, it starts hurting, and then actually I just want to fall asleep, and I have to sleep for about an hour or so and then get back up. But if I stand up, like at work and stuff, I compute a lot, so I stand, and I can work for a longer period of time.
So standing is easier, sitting is a problem.
Yes.
And how old are you?
50 January.
And you've had this problem for how long?
Since 2010.
And John, have you had an MRI of your lower back?
Well, I know I had 7 MRIs on my brain when I had the lesions in my brain. I don't know if they did any other part of my body, but
what was going on with these lesions in your brain? What was that?
Well, the short story is that everything was going good that year. I was doing great in my business, and I was standing in my office, and I got dizzy. My eyes got blurry. I went to see my eye doctor. Eye doctor said nothing's wrong with your eyes. Go to your medical doctor. I went to his office. I sat down. I laid on the couch, and I woke up in the hospital 20-some days later. Never even knew how I got there. My neurologist asked me what day it was.
And what exactly was it?
Well, they found out that when I first went in, I had 4 lesions in my brain, and then I had 10 new ones in a week, and then another 10 new ones in another week. So every week I was getting these lesions. They originally thought it was vasculitis, but he gave me another name of autoimmune disease that they believe attacked my brain because they gave me steroids to shut my immune system down.
And are you okay now?
But yeah, pretty good. I got that pain, and actually the other problem I have is I have to catheterize to use the restroom.
Since this brain business?
Yeah.
Well, it's probably, I don't know for sure, but it's likely that the back problem may be unrelated to the rest of this stuff. It sounds like a run-of-the-mill disc problem. Now, whatever lesions you're getting in your brain, I suppose you could get them elsewhere. But those lesions now have resolved more or less. You're on pills and it keeps it under control. Is that true?
No medication anymore. I had steroids for a while, and then for the pain I was.
But you're able to walk okay?
Oh yeah, but when I woke up, I couldn't walk.
Right.
I couldn't do much of anything.
Yeah, so you're a miracle basically.
That's what my doctor says.
Yeah, it sounds like a miracle. I don't, that's a complication that I don't deal with very often, obviously. That's very rare. But if all you have is back pain with sitting, relieved with standing, you probably have a disc if none of this other stuff is relevant. And that can be treated very effectively, either with forms of physical therapy like traction or manipulation, exercises. Sometimes we give shots like this, that same type of cortisone they gave you by mouth. You can get
prednisone.
Yeah, prednisone. That same family of medicine can be injected around the disc if that's what the problem is, and you can get better. So you dodged a bullet kind of, and they're probably all happy about that. But now you have a back problem, which, like I said, may or may not be related to the problem in hand. I can't say for sure.
Yeah, I took some acupuncture for a while, and actually, I was having to do Vicodin for her to get through the day, and then I finally said, I'm not going to do any more of that.
Yeah.
I was cold turkey off of that and went to acupuncture, and that got me going a little bit better, loosened me up, and then I started doing some exercising with some rollers, doing the rolling on the side.
What you're describing are a lot of treatments which can give you some relief. But I would like to approach this a little bit more directly. You know, acupuncture can be great to give you some temporary relief, but let's find something that can give you more lasting benefit.
Okay.
That would be my recommendation. So seek additional help. Talk to an orthopedist. Come in and see me if you like, or one of my associates. But it sounds like you may have a separate, unrelated symptom in your lower back, problem in your lower back. And last thing, remember, sciatica is not a diagnosis. It's a complaint. All right? So don't let anyone tell you your diagnosis is sciatica. Anyone says that, you say, okay, thanks. I got pain behind my knee. I'm telling you that. I got pain down my thigh. That's what I'm telling you. I want to know why. Mm-hmm. All right?
Do you think it has is there any relation to not being able to urinate?
Serious disc problems can push on a nerve and make it difficult to urinate. But because you had all these lesions in your brain, I suspect that that's where it's coming from your brain, recent brain condition.
Yeah.
There are tests that can be done to better define this. It's called urodynamics. And these are done by urologists, urologist.
Yeah, I have one of those too.
And your urologist should be able to do one of these urodynamic testing and to tell you where the urine problem is coming from. Your brain, probably, or your back, less likely. Okay, so ask your urologist that question.
Okay.
All right, John, thanks for the call. Good luck for that.
All right.
Yeah, bye-bye. 521-8383. Jim, go ahead. You're on the air, and thanks for calling.
Oh, okay. Doctor, I had a question about, everyone's different, but when someone comes in with sort of like a deep strain in their back muscle, how long does that typically take to clear up with physical therapy and...
Right. When people simply strain a muscle in their back, and it doesn't involve the spine or the disc or the facet joints or a pinched nerve, they just tweak the muscle, I don't usually see them. It usually passes very quickly. You know, just like you tear a little muscle in your calf, it's possible to and you hobble around for a few days, and it's pretty good. You can similarly tear or stretch a little muscle in your lower back and have a similar thing, and in a few days or a week it feels better. I don't think that happens very often, by the way, and it's diagnosed way too often. Most people who come to me and tell me what you just said, what did you say exactly? I have a pulled muscle in my back?
Yeah, that's what I think I strained
a muscle. Most people that come to me and think that they've strained a muscle in their back actually have another problem that's causing the muscle to feel that way. But usually it's like they injured a disc in their back or a little joint in their back. And it manifests as a muscle soreness or a muscle spasm or a muscle tightness up to one side or the other or both. But the muscle complaint, usually, I'm not saying all the time, but usually, at least in my experience, is a secondary reaction to a more deep-seated cause of the problem in the spine itself. How long have you been having this?
Say 3.5 weeks, and I exercise. I'm doing some deep stretches and so forth, and trying to get just. And it seems to, it's a lot better than it was, but it's still it's still sore on my right side.
And sitting bothers you?
Yeah, after a while, I don't like to sit too long anyway. I'll get up and move around.
Right, but could you imagine going to a 2-hour movie right now and sitting comfortably through it?
Maybe not.
Maybe. Nothing like a man willing to commit.
Yeah, I'm honestly not sure.
What about standing? Can you stand for a couple hours, or does that become...
Yeah, I can stand a couple hours. In fact, I did it the other night, yeah.
If you cough or sneeze, does that bother you?
No.
If you bend forward, if you're standing and you have to bend forward and, brush your teeth or wash dishes or put dishes in the dishwasher or get some stuff down from a lower cupboard, does bending down aggravate things?
Yeah, I have to do that rather gingerly unless I'm fully stretched out and been moving around a while,
And when you lie down, do you get pretty good relief?
Yeah, when I lie down, I have no problem sleeping.
Jim, how old are you?
67.
Right, and are you working?
No, I don't work. I haven't worked since 18 months ago. I retired.
How do you like it?
I like it. I stay busy as a devil. Yeah.
Yeah, you get busy hurting your back, which brings up another question. How the heck did you do this, being retired and all? What were you lifting? What were you digging? What were you moving?
Yeah. I was headed back to the mainland for my 50th high school reunion, and I hadn't even left wasn't 10 feet from my door, but all I took was an overhead, and when I went to put it into my wife's car, she was dropping me off, I felt something. I inched my back a little bit, and I told her right then and there, I did something to my back, and I could tell when I did it. I just kind of.
And then you got on the plane?
Oh yeah.
And then sitting on the plane, you got off a lot worse.
That was brutal. Yep.
Yeah, because sitting on a plane is a double whammy. Number one, you're sitting, and the chairs don't have to be that comfortable. And number two, you're sitting for a long, long time. And number three, a triple whammy. The pressure in the cabin when you go up high, 35,000 feet, they pressurize the cabin. But it's not as much pressure as you have at sea level, which is what we have here. Mm-hmm. So the pressure surrounding your disc is less, and the pressure inside your disc is then allowed to expand outward. So that's my own theory, anyway.
Well, I think you hit something because
it's terrible.
I was supposed to have an aisle seat, and when I got there, a young lady had the aisle seat. So I just told her straight out, I said, I'm going to be up a lot, moving around. And I told her, I'll buy you dinner, I'll give you $50, whatever you want to switch seats. She was a real nice kid, she switched. And so I stood around and walked around a lot. But there's no way I could have sat through that flight.
Yeah, no. So here's the thing. Without seeing you, I can't say, but I'm going to say anyways. You have a disc problem. I'm, 5 will get you 8. That this is a disc problem. It's not necessarily a terrible, untreatable disc problem, but you asked the wrong question. How long is it going to be if I have a muscle ache to get better? It'll be as long as it takes you to get the right treatment.
I got you.
So what you need to do is confirm the diagnosis, but I would bet a lot of money at those odds that that's what this is. And once we know it's a disc, then there's treatments such as traction, manipulation, certain exercises. You have to avoid sitting. Don't wait an hour before it hurts. Get up every 15, 20 minutes and stretch around. The therapist can teach you specific exercises to do. If we have to confirm the diagnosis, an MRI is sometimes useful. If we suspect actual nerve damage in your back causing the leg sciatica, an EMG can be done to better identify and locate the nerve that's injured. Sometimes in more severe cases that don't get better with time and rest and therapy, epidural injection can be very, very well, I almost said the word curative. I hesitate. But very, very successful in getting you back to a pain-free state. And then, of course, even if you had all this and you got all your symptoms gone, it doesn't mean you would be normal. The biggest mistake and the biggest problem is not getting rid of this episode, but preventing the next one.
Right.
So once we get you over this, then it's a process of rehabilitation, which is a lifetime effort. Is this the first time you've had this?
I've had some minor low back issues in the past, but never anything that's hung on this long.
And it always felt I tweaked a muscle in my back. I sprained my back.
Once in a while.
Yeah. All of those times I represent to you, I suggest that all those little tweaks over the years that seem minor was the same disc starting to act up and slowly worsen. What kind of work do you, you're retired?
Yes, sir.
I see. So what you want to do is get over this episode, whatever it takes. I'll be happy to help you with that if you want. But get over this episode, learn core strengthening. It's the muscles that keep your trunk solid. And
I have to tell you, I do that all the time for years.
All right, so keep that up. Make sure you have flexibility in your hamstrings and so on. Know proper technique when you have to bend, lift, carry, so as not to unduly stress your back. And avoid the next episode. If you do all those things and continually get episodes, then you got to do something to stabilize your back. Wear a brace, get Prolo-Therapy, who knows.
Can I ask you one thing?
Yeah, go ahead.
How would you determine the disc issue? How would you verify that?
Well, first of all, I already have, just from talking to you. I can't think of what else this might be. There's a possibility that this is a SI joint problem, but I would examine you, and then if I was convinced that this was a disc, like I think it is over the phone, I would treat you for it. And if you got better, I would know I was right. If you didn't get better, I would probably get an MRI, a picture of your back.
I see.
Which can help us. The problem with the MRI is it's sometimes too sensitive. So we get a picture, we get an MRI of someone's lumbar spine, and they have bulging discs at 4 different levels, and we don't even know if any one or which ones of those are responsible for the patient's pain. It can be overly diagnostic and a little bit confusing. So I don't like to rely on the MRI to make that kind of diagnosis. Now, some people have a blown out disc and it pushes on a nerve and they have weakness in their leg, not just sciatica. And then the MRI shows a big old disc way out of place, and we know that that's probably a relationship there. But MRI is a pretty good test. For the sciatica, I mentioned a EMG can help us sort that out.
Well, I really don't have any shooting pains down my leg or anything. It's just...
You have pain in your thigh?
My thigh? No. It's just that right
right buttock, right back and buttock?
The buttock, I do deep stretches for every morning. I wouldn't say it's the buttock. I would say it's just the right lower back.
So you don't really have sciatica, do you?
No, I wouldn't say sciatica.
No, I wouldn't either. Okay, so seek out help. Look for that diagnosis. Consider it a disc until someone proves otherwise.
Okay.
And avoid sitting and avoid lifting and carrying. Keep and come in if nothing else helps you.
Yes.
Come in. I'll think about an epidural injection for you.
Okay.
Very easy.
I got you.
All right.
Thank you, Doctor.
Thanks for the call. I appreciate
it.
Bye-bye. Aloha. Let's see now. Drop that. Let me we're running out of time. I got another 5 or 8 minutes. I want to plug my buddy's real estate seminar. It's a living trust seminar. It's for people who don't have wills or trusts, or maybe they have a will but not a trust, or have a trust but don't have a will. He's a lawyer who's also an accountant and a computer wizard, and he gives these seminars, not just in Hawaii, but I know he goes to the mainland, California for sure, and helps people set up their wills and trusts so that when they pass away, when we pass away, if and when we become incapacitated, your wishes are legally known, and the probate judge, if that's what it comes down to, looks at your properly executed will or trust, and it's taken care of quickly without a lot of an expense, hassle for the family that you leave behind. It's incredible, and I say this from personal experience. And not my own, but other people in my family. It's incredible how often, how common it is that siblings get into a fight over who gets what after the parents die. And the parents didn't take the time to let their wishes be known. It wasn't clear, and then they fight, and then they hate each other. And the parents have done a major disservice for the kids. And I hate to say it, but that happens more often than not. So go listen to David. Today he's at Waialae Country Club, but I'm pretty sure they're sold out. Maybe you could go there and stand 10 o'clock at the Waialae Country Club. But tomorrow I know there's seats at the Ala Moana Hotel at 2 o'clock. Take down this number, 533-3243, and make a reservation for tomorrow at 2 o'clock, Ala Moana Hotel. You won't be sorry. It's a real service to do for your family members that you're going to leave. Enough of that. We have another couple of minutes. If you just tuned in, my name is Dr. Bernie Portner. I'm an MD physiatrist, whatever that is, specializing in physical medicine rehabilitation. But actually what I do, as most of you know by now, is I diagnose difficult, sometimes very difficult causes for pains felt in the arms or in the legs or the buttock or the shoulder or the neck or the back. It's a very interesting detective-like work. Where is this pain coming from? I very much don't like general diagnoses like mechanical low back or degenerative disc disease or fibromyalgia or all these phrases that don't really tell us anything and are not accurate in terms of pointing out, naming, pinpointing the actual cause of the pain. That's the goal of the orthopedic diagnostician of myself. Which tendon, which ligament, which disc, which bone, which fascia, which meniscus, which joint. Where is the pain coming from? And the trick is sometimes the pain is felt in places removed from where the pain is actually originating from. So you can have a slip disc in your back. Your back might not hurt, but you might be feeling pain in your back of your thigh. That's sciatica we're talking about. So it can be tricky. And then I'm a non-surgical orthopedist, so most of these conditions, whether it's a bursitis in the knee or a tendonitis in the shoulder or a pinched nerve in the neck or a slip disc in the back or a swollen joint in the knee or osteoarthritis of the ankle or hip or a tendonitis of the elbow, any of these things are rarely surgical in nature. That means they rarely require surgery. What they require after getting an accurate diagnosis is some proper non-surgical treatment. That may be rest, a brace, physical therapies of various sorts. And when I say physical therapy, I don't mean what we call in the business fake and bake, which means you go to the therapist and they put a bunch of heat on it, and then they put a bunch of electricity on it, and then they put a bunch of ultrasound on it, and then they have you sit on the stationary bike. That's not physical therapy I'm talking about. I'm talking about therapy that's physical, directed at the lesion. So if it's a tendonitis, we put our thumb on the tendon and rub across it. If it's a disc, we put you in traction and we stretch that disc out and get it back into place. If it's bad posture causing arthritic conditions in the spine, we work on the posture and we teach postural exercises. If people have a bone out of place, we do a manipulation and put it back in. That's physical therapy. It's not just exercise. Exercise comes later. Exercise is for once you're better. Then we do rehabilitation to maximize function and minimize chances of recurrence. So that's the physical medicine rehabilitation part of my field. A quick announcement. We have just another minute or so. A quick announcement. As most of you know, we are moving the office to 1132 Bishop Street. It's a beautiful new office, plenty of room. I get my own private office for the first time in many years. I've shared my office for quite a while. I'm excited about that, and I can do my teaching right in my own office. I do teach, which I just want to say, Dr. David Bro is my newest student, starting just in a week or so. And he'll be under my wing for a year, and then we'll let him fly out on his own, and he'll be taking care of the citizens of Hawaii just like I am. Who knows, maybe we'll bring David onto the radio show next week. I think he's going to be in town. If not then, sometime soon. That about wraps it up, everybody. I hope you had a good time listening to the show. I'll be back here next week to try to answer your questions. In the meantime, we got a weekend coming up, a 3-day weekend. Don't forget Memorial Day. You see what I did there? Bye, everybody. Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, legs, neck, or back, and would like to get an appointment over at the office on Pe'ikoi Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray is normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time, on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot